Hello friends, I am Dr. Ankit Batra, a cancer specialist. I am a medical oncologist. I am currently working in Himalayan Institute of Medical Sciences, Dehradun. Today we will be talking about head and neck cancers. As we all know that April month is being celebrated or being used to create awareness about the world head and neck cancers. So we will be discussing about head and neck cancers, how to deal with it, how to avoid it, what are the symptoms, how we can prevent it, and if anyone is suffering from head and neck cancers, how we can help them to treat and hold their hands in their journey. And also we'll talk about the survivorship about the head and neck cancers. So what is head and neck cancers? Basically it is a growth or a lump or a ulcers occurring in the head and neck regions, which is usually the oral cavity, the larynx, the pharynx, hypopharynx, or the nasal cavities. So together all these parts constitutes the head and neck region, and any cancers in form of any lump or ulcer or node developing in this region is known as head and neck cancers. So head and neck cancers, why it is important? It is a very huge burden on our population. If we talk about the world, it is the 6th most common cancers worldwide. If we talk about our country, that is India, it is also a very major burden, and it is the 2nd most common cancers among all the population in India. If we talk about especially about the males, it is the 1st most common cancers which is occurring in Indian subcontinent. And if we talk about the facts, more than 1.5 lakhs patients are being diagnosed with head and neck cancers in our country, and it is a very difficult cancer to treat, to manage the patient, and to maintain a good quality of life during and after the treatment. So it is better to, rather than treating this cancer, we should prevent this cancer. So firstly we'll know about that, how we can avoid. So we need to know what are the reasons behind these cancers, why it is occurring. So the most important reason for this cancer is tobacco chewing. Tobacco in any form, be it chewing, be it snuffing or smoking, is the most important reason for the occurrence of these cancers. So if we avoid eating tobacco in any form, then we can significantly reduce the burden of these cancers. Apart from tobacco, we have various other reasons, that is heavy consumption of the alcohol, various other factors like poor oral hygiene, poor dentition, and poor immunity, and poor nutrition. So all these factors also contributes to the occurrence of head and neck cancers. Apart from these, now there is a growing incidence of human papilloma virus, which is also significantly increasing and causes the head and neck cancers, especially the oropharyngeal cancers, which is also because of various disturbances or changes in the sexual practices which we should avoid. And these are the foremost reasons of why the head and neck cancer develop. So if we know the etiology, we can help in prevention of the occurrence of these cancers and significantly reduce the burden of head and neck cancers. Moving on to the symptoms. So what are the symptoms? How can one know that he is having or going to develop head and neck cancers? So any chronic ulcer or growth in mucosa or in neck region which is there for more than 3 to 4 weeks should be considered and being evaluated by any physician nearby you, and a differential diagnosis of cancer should be sought. So any ulcer or lump which is not being treated with the conventional local treatments and it persisting for 3 to 4 months, or any chronic bleeding from these ulcers, should definitely sought a physician's or a specialist opinion to rule out any form of cancer. So these are the major symptoms which we need to know so that we can diagnose the disease in the early stages itself. Now for all those patients who have already developed the head and neck cancers, they should see a cancer specialist or a cancer expert as early as possible. And what are the treatment options? So if a head and neck cancer is being diagnosed in early ages, it is highly curable, but unfortunately most of our head and neck cancers are being diagnosed in advanced stages because of the lack of awareness and knowledge, and that's why they are incurable. So our aim is to catch them early, diagnose them early, and treat them early. So what are the treatment options? Majorly the head and neck cancers are being treated by surgery. There is a complete resections of these tumor along with the neck dissection, which are basically is the lymph nodes in the neck, which we also remove along with the primary ulcer or the lump. And The other important treatment are radiotherapy, Now we have newer radiotherapy techniques which helps in consolidation as well as in the adjuvant form of the treatment and helps to cure the patient from this head and neck cancers. All those patients who are in advanced stages, a concurrent, which is a chemotherapy along with radiotherapy, is also given in these kind of patients to achieve them better response rates and cure rates. All those patients who are in stage 4, there is a lot of research going on, especially in this area, because this is a very aggressive and a resistant form of cancers. Once reaches in stage 4 is very difficult to tackle. So a lot of research is going on for stage 4 head and neck cancers also. And now we have armamentarium of drugs, mainly not in the form of chemotherapy, which was a long options for us for last few decades, but recently we have options of immunotherapy, targeted therapy, and other forms of molecular and precision oncology based therapies also. So this was about the treatment. Now all those patients who are being undergone with this treatment or who have undergone and now a survivor, the very important issue which needs to be taken care is a good oral hygiene, maintain very good nutrition, because nutrition helps in the recovery of the patient and also to prevent the secondary cancers in the head and neck regions. So nutrition in a patient who is undergoing treatment for head and neck cancers is very important and should not be neglected. Even after the treatment, a very good nutrition should be maintained. Also a good oral hygiene, as I already told, should be followed to prevent late complications of the treatment. And a quality of life is one of the important factors which now the oncologists focus on. It's not only the treatment, but a good functional and anatomical quality of life should be maintained. So quality of life is very important, and various techniques and supports are being developed to improve the quality of life. So this was all about the head and neck cancers. Lastly, I would like to re-emphasize that prevention is the key rather than going into treatment. We are there to help all the patients hold their hands during the journey of the treatment as well as after the treatment. But it is for the masses, for the general population, that prevention is the key. So I request you all to avoid any form of tobacco, alcohol, maintain a good oral hygiene, nutrition, and practice safe sexual practices so that you and your family members can be prevented from developing a head and neck cancers. Thank you.